Warm welcome to the latest OncoShorts podcast, brought to you by MedSynapse. OncoShorts covers a wide range of clinical and scientific medical content that offers enriching insights into the world of oncology. In today's podcast episode, we will discuss details of a randomized phase 2 trial, titled Camrelizumab plus Apatinib in patients with high-risk chemorefractory or relapsed gestational trophoblastic neoplasia, featured in the November 2021 issue of the Lancet Oncology. Gestational trophoblastic disease or GTD is rare, affecting about 1 in every 1,000 pregnant women. While some GTD tumors are malignant or have the potential to turn cancerous, the majority are benign. For diagnosis, tests such as Pap test or urinalysis are conducted to rule out other possibilities and detect changes that may be cancerous. Chemotherapy or radiation therapy may be used as the first line of therapy to kill cancer cells or shrink them. The majority of women requiring chemotherapy for gestational trophoblastic disease are cured with their initial chemotherapy treatment. However, a small percentage either become refractory to treatment or relapse after the completion of treatment. Recently, the combination of immunotherapy and anti-angiogenic drugs has shown to improve the patients with gestational trophoblastic neoplasia. This is an open-label, phase 2 trial, wherein the primary endpoint is objective response rate, evaluated according to the serum human chorionic gonadotrophin concentration. Women between the age group of 18 to 70 years old, with high-risk chemorefractory or relapsed gestational trophoblastic neoplasia, who had received at least 2 lines of previously unsuccessful multi-drug chemotherapy regimens, were included. The treatment involved 4-week cycles of intravenous Camrelizumab 200 mg every 2 weeks, plus oral Apatinib 250 mg once per day, until disease progression or unacceptable toxicity. The study witnessed that 95% patients were diagnosed with choriocarcinoma and 5% had placental site trophoblastic tumor, 19 versus 1. The most common grade treatment-related adverse event was hypertension, which was observed in 5 patients. The other adverse events noticed were rash, neutropenia, leukocytopenia, and aspartate aminotransferase. Besides these, 1 patient witnessed an extreme condition of aspartate aminotransferase, which was higher than the normal level. Thus, we can conclude that the combined effect of Camrelizumab plus Apatinib shows an excellent result while dealing with patients suffering from high-risk chemorefractory or relapsed gestational trophoblastic neoplasia. It can be considered as an option after chemotherapy due to its anti-tumor activity and acceptable toxicity. This ends our today's OncoShorts podcast, brought to you by MedSynapse. Thank you for listening.